However, if we think of the concept of plyometric exercises, there are absolutely ways that someone, even with low mobility, could perform these exercises. So, what is the main component of a plyometric exercise? A muscle quickly lengthens and shortens. Think of that rubber band. We're trying to get that rubber band motion. We want a very quick lengthening and a very rapid shortening with very little latency time between the lengthening and the shortening, meaning there's no pause or anything. It just quickly recoils back, right? So what are some ways we can do this? Well, one way we can do this that I've shown quite a bit on this channel is using a TheraBand and attaching it to a wall or overhead and just letting the band pull the leg up and then push it down, pull the leg up, and then you push your leg down. That's lengthening of the muscles on the back of the leg and then a quick shortening. So you're allowing that band to kind of help you create that kind of pogo or bouncing motion. The other way I love to do this is on a mini tramp. So you can just stand on a mini tramp, and with 2 feet on the mini tramp, you could just do little oscillations. Right now, that exercise in particular might seem scary to some of you, but so don't do it on your own. But in therapy, there's lots of ways to get someone onto a mini tramp that's really low level. And then you can put it inside parallel bars to make it very, very safe for someone. And then you're not jumping on the trampoline, you're taking advantage of the springs on that trampoline to start creating that pogo motion, right? A little bit of a soft knee bend is a little bit of a lengthening, short, lengthening, shortening, lengthening, shortening, right? That up and down, as long as you're giving with that, your knees. I love a mini tramp because not only that is it starts to, remember I told you at the very beginning, you also lose the coordination between muscles, and there's those normal muscle synergies that we get between muscles. In this situation on a mini tramp, you're learning how to coordinate your ankle muscles with your knee and your hip muscles. So that's why I love it, is it's not only like helping to rebuild that stretch lengthening cycle within a muscle, but it's also getting groups of muscles to work together. So that's another way that I love to incorporate this type of a plyometric exercise into someone's routine.